Hello and welcome viewers. Today we are going to discuss the Medical Termination of Pregnancy Act, also simply known as MTP Act. We will start with the original 1971 legislation and then move on to the 2021 amendments. This is also a very important topic for gynae as well as forensic medicine. So, what was the purpose of the MTP Act of 1971? The core aim was to legalize abortion under specific conditions to protect the woman's health. Before this act, many pregnancies were terminated illegally and unsafely, posing risk to the health of the woman. By legalizing abortions under defined circumstances, the act aimed to ensure safer medical procedure. Now, let us talk about the grounds for termination under the 1971 Act. First, there is the social ground. If there is a failure of the contraceptive method, the pregnancy can be terminated. Second is the eugenic ground. If there is any chromosomal abnormality or genetic defect in the fetus, termination is allowed to avoid risk. Third is the therapeutic ground. If continuing pregnancy endangers the woman's life, the pregnant woman's life, it can be ended. Lastly, we have the humanitarian ground. Pregnancies resulting from rape are grounds for legal termination. When it comes to who can perform the MTPs, the 1971 specified that a registered medical practitioner or RMP with certain qualifications could do so. First is that he or she must have completed a 6 months of house job in gynecological department in a government institution, or 1 year of experience in the gynecological department, gynae and obs department rather I would say, in a private institution. He must have performed previously 25 MTPs, out of which 5 he must have done independently. So these are the qualities. If a RMP has it, then he or she can perform the MTP. Next is, if the doctor has done MD in gynae obs or DGO, then he or she is a qualified person to perform the MTP. Now let us come to the gestational age limit. Up to 12 weeks of gestation, one RMP could perform the procedure. However, if the gestational age is between 12 to 20 weeks, 2 or more qualified doctors are required, or opinion of 2 doctors are required. And MTP 1971 Act, most importantly, does not allow termination of pregnancy beyond 20 weeks. Please remember this. Okay. Fast forward to the MTP Amendment Act of 2021, and we see some significant changes. The amendment was introduced to modernize the 1971 Act and reflect current social and medical realities. The new amendment allows termination up to 24 weeks for certain categories of women, especially the rape survivors or survivors of sexual assault, and also those facing substantial fetal abnormalities. Even those cases can go beyond 24 weeks, but there must be opinion of a medical board. Okay, so however, we can say there is no upper limit for termination of a pregnancy if there are severe fetal abnormalities or substantial fetal abnormalities are detected. Obviously, with a medical board's opinion if it is beyond 24 weeks. Now, who constitutes a medical board? A medical board is constituted by a gynecologist, a radiologist or a sonologist and a pediatrician. So please note that there is some error in the diagram. A medical board constitutes of a gynecologist, a pediatrician and a radiologist or a sonologist. And if the gestational age is 20 to 24 weeks, opinion of two doctors are required to perform an MTP. And if the gestational age is more than 24 weeks, medical board should decide whether MTP should be done or not. If the gestational age is beyond 20 weeks, then opinion of one doctor is enough for termination of the pregnancy. Okay. Now let us see the benefits of 2021 amendments, which includes strengthening of the reproductive rights and expanding the access regardless of the marital status, and confidentiality provisions were also enhanced with stricter penalties for breaches of privacy. Now this one slide is can be used to differentiate MTP Act 1971 and MTP Act 2021. Firstly, 1971 were applied only for married women, whereas changes were done in 2021 where unmarried women was also covered. Now gestational age, as I told you earlier, 1971 Act covers 20 weeks for all indications. So beyond 20 weeks, one couldn't go according to the 1971 Act, but now according to the recent 2021 Act, 24 weeks for rape survivors, beyond 24 weeks for substantial fetal abnormalities, provided medical board has approved it. Now, previously we have seen that one RMP was needed if the gestational age of the fetus was 12 weeks. Here, if it is still 20 weeks, opinion of one RMP is enough to perform the MTP. And in 1971, if the gestational age is 12 to 20 weeks, then 2 RMPs were required, or opinion of 2 RMPs mattered. Here, if the gestational age is 20 to 24 weeks, the opinion of 2 RMPs mattered. And here, medical board approval will be needed if the gestational age of the fetus is after 24 weeks. Is beyond 24 weeks in case of substantial fetal abnormality. So this is the important difference, that this age limit and also when the opinion of 2 medical practitioners was needed in 1971 and when the opinion of 2 doctors will be needed in 2021 Act. So these two is important to note. And also the breach of women's confidentiality is also important. In 1971, fine was only up to 1,000. Whereas in 2021, the penalties are improved, fine is charged, and also imprisonment of 1 year may also be issued according to the crime. Okay, so this is the basic difference between the 1971 Act and 2021 Act. So I hope you like it. Thank you.